Monkeypox, a name that has recently become more familiar to many of us. You've probably heard the name in the news lately, and it's not without reason. This viral disease has been making headlines, and for good reason. The sudden surge in cases has caught the attention of health experts and the general public alike. Once confined mostly to Central and West Africa, monkeypox has been appearing in countries all over the world. The virus, which was once a rare and isolated occurrence, is now a global concern. This spread has public health officials concerned. The rapid transmission and the potential for widespread outbreaks have led to urgent meetings and discussions among health authorities. It's important for everyone to understand this virus. Awareness and education are key in combating the spread of monkeypox. We'll discuss what it is, how it spreads, and what you can do to protect yourself. Understanding the modes of transmission and the symptoms can help in early detection and prevention. Monkeypox is a serious health threat. The symptoms can range from mild to severe, and in some cases it can be fatal. Understanding this virus is crucial. Knowledge is power. By educating ourselves, we can take the necessary precautions to protect our health and the health of those around us. By learning about monkeypox, we can all do our part to stay safe and healthy. Public awareness campaigns and educational resources are essential in spreading accurate information. This essay will give you the facts you need. From understanding the origins of the virus to the latest research and developments, we aim to provide a comprehensive overview. Stay tuned as we delve deeper into the world of monkeypox, exploring its impact on global health and what measures are being taken to control its spread. Together, through knowledge and action, we can address this growing concern and work towards a healthier future for all. Monkeypox isn't new. Scientists first discovered the virus in 1958. They found it in monkeys used for research. That's how it got its name. The first human case of monkeypox wasn't until 1970. It occurred in the Democratic Republic of Congo. Since then, monkeypox has been found in several Central and West African countries. The virus has natural hosts in the wild. These include rope squirrels, tree squirrels, Gambian pouched rats, and dormice. These animals can carry the virus without showing symptoms. Monkeypox spreads in a few ways. It can pass from animals to humans. This can happen through a bite or scratch. It can also happen through contact with an infected animal's bodily fluids. Human-to-human transmission is possible too. This usually requires close contact. This could be through direct contact with the rash, scabs, or bodily fluids of an infected person. Respiratory droplets can also spread the virus. This is more likely with prolonged face-to-face contact. It's also possible to get monkeypox from contaminated materials. This includes things like bedding or clothing. Monkeypox usually starts with flu-like symptoms. You might experience fever, which can be quite high and persistent. Along with the fever, you may develop a headache, which can range from mild to severe, making it difficult to concentrate or perform daily tasks. Muscle aches are also common, often affecting various parts of the body, including the back. Back pain can be particularly troublesome, sometimes making it hard to move or find a comfortable position. Chills and exhaustion are other frequent symptoms, leaving you feeling drained and fatigued. Swollen lymph nodes are a hallmark of monkeypox. These can be felt as tender lumps in areas like the neck, armpits, or groin. This sets it apart from similar illnesses, such as chickenpox or measles, which do not typically cause lymph node swelling. A rash typically appears 1 to 5 days after the fever starts. This rash is a key indicator of monkeypox and can help in diagnosing the disease. This rash often begins on the face, making it one of the first visible signs of the infection. It then spreads to other parts of the body, including the arms, legs, and torso, covering a significant portion of the skin. This includes the palms of the hands and soles of the feet, areas that are not commonly affected by other rash-causing illnesses. The rash goes through distinct stages, each with its own characteristics and appearance. It starts as flat lesions, which are small, discolored patches on the skin. These lesions then turn into raised bumps, becoming more noticeable and sometimes itchy or painful. The bumps fill with fluid and become pustules, which are small, blister-like sores that can be quite uncomfortable. Eventually, the pustules scab over and fall off, leaving the skin to heal. This process can take several weeks, and it's important to avoid scratching to prevent scarring or secondary infections. Who is most at risk? Well, anyone can get monkeypox. However, some groups are at higher risk. People living in or traveling to Central and West Africa are more likely to encounter the virus. Those who have contact with infected animals are also at risk. Healthcare workers caring for monkeypox patients face an increased risk of exposure. People with weakened immune systems are more vulnerable to severe illness. This includes individuals with HIV/AIDS or those undergoing chemotherapy. It's important to remember that the virus can affect anyone. Monkeypox around the globe, recent outbreaks. In recent months, the world has seen a surge in monkeypox cases, sparking concern and prompting swift action from health authorities globally. Monkeypox has traditionally been confined to Africa, particularly in the central and western regions where it is endemic. The virus is often found in wild animals such as rodents and primates, and it occasionally spills over to humans. However, recent outbreaks have been reported in other parts of the world, including Europe, North America, and Asia. This marks a significant shift in the virus's behavior and its ability to spread beyond its traditional boundaries. This is concerning for public health officials, who are now faced with the challenge of containing the virus in multiple regions simultaneously. They are working tirelessly to track the spread, understand the transmission dynamics, and develop effective containment strategies. These outbreaks highlight the potential for the virus to spread globally, especially in our interconnected world where international travel is common. The rapid movement of people across borders can facilitate the spread of infectious diseases like monkeypox. In 2022, several countries reported cases of monkeypox, with clusters of infections appearing in unexpected locations. This has led to increased surveillance and reporting, as well as heightened public awareness about the disease. Many of these cases were linked to travel from Nigeria, where the virus is known to circulate. Travelers returning from affected areas have inadvertently carried the virus to new regions, leading to local outbreaks. This raised concerns about international spread, prompting health organizations to issue travel advisories and implement screening measures at airports and other points of entry. The goal is to identify and isolate cases early to prevent further transmission. Community transmission has also been reported in some areas outside of Africa, indicating that the virus is spreading from person to person within these communities. This poses a significant challenge for containment efforts. This means that people are contracting the virus without known travel or animal contact, suggesting that the virus is now circulating more widely in the human population. Health workers are conducting extensive contact tracing and testing to identify and isolate cases, aiming to curb the spread of the virus. Combating the virus, public health actions. Public health organizations are working hard to contain the spread of monkeypox. The World Health Organization, or WHO, is closely monitoring the situation. They are providing guidance to countries on outbreak response. Awareness campaigns are crucial. These campaigns educate the public about monkeypox. This includes information on symptoms, transmission, and prevention. Vaccination is another important tool in the fight against monkeypox. The smallpox vaccine provides some protection against monkeypox. Protecting yourself. Prevention and treatment. Preventing monkeypox involves taking simple precautions. Avoid contact with animals that could carry the virus. This is especially important in areas where monkeypox is known to occur. Practice good hygiene. Wash your hands frequently with soap and water. Use alcohol-based hand sanitizer if soap and water aren't available. Avoid close contact with people who are sick. This includes anyone with a rash that could be monkeypox. If you do need to be around someone who is sick, wear a mask. Living with monkeypox, managing the disease. Most people with monkeypox recover fully. However, the illness can be serious. It can even be fatal in some cases. There is no specific treatment for monkeypox. However, there are antiviral medications that can be used to manage symptoms. Treatment is primarily supportive. This means managing symptoms like fever and pain. It also means ensuring the patient stays hydrated and comfortable. The future of monkeypox research and outlook. Scientists are constantly learning more about monkeypox. Research is ongoing to develop better diagnostic tests, vaccines, and treatments. Understanding how the virus spreads and evolves is crucial. This helps public health officials to develop effective control measures. The future of monkeypox depends on a multifaceted approach. This includes robust surveillance, effective public health interventions, and continued research efforts. Staying informed, staying safe, your role in public health.
Monkeypox is a global health concern, but we can all do our part to stay safe and prevent its spread. Stay informed about the latest developments. Follow reliable sources of information like the WHO and the CDC. Be aware of the symptoms. Take precautions to protect yourself. Practice good hygiene and avoid close contact with sick individuals. By staying informed and taking preventive measures, we can collectively combat this emerging health threat. Your health and the health of our communities depend on it.
Thank you for watching and stay safe. Pause to S. For more information and updates, follow reliable sources like the WHO and the CDC. Together we can make a difference. Pause to S. Subscribe to our channel for more informative content on public health and safety.